Hi, my name is Elena Butler. I am going to talk about the slide that I have for my class, Supporting Adolescents in Substance Use Prevention and Treatment with Grand Canyon University, due August 24th, 2025, Dr. P. I also just want to have a disclaimer that I do have long COVID symptoms, so my breathing is kind of nasty, which is what prevented me from doing some videos. So, introduction, what is cultural competency? The ability to interact efficiently with clients from diverse cultures involves awareness and knowledge and skills. It is essential for ethical respect and effective treatment. Awareness, being cautious of your own cultural identity and biases. Knowledge, learning about cultural practices and worldviews. So I think for me, one thing that I've done in my past is if I don't fully understand something, I'll ask for clarification. I think that shows a lot of personal growth and a lot of acceptance of other people. I think also the ability to apply cultural appropriate interventions and adapt your communication style. I will say that in my past careers, I have worked with people who don't text and don't really use the phone, or in my previous job, we had a lot of people who culturally discipline their children in a different manner, so that really you have to be aware of different cultures and what those different cultures bring along to your career. I think without cultural competency, there's a misunderstanding or a risk for misunderstanding between the patient and the clinician, and that can cause a lot of damage to the relationship. So I think that it's very important to make sure that you clarify that. The counselor's identity and knowledge, skills, and attitude. For that, a counselor's professional identity and deep commitment to cultural differences, which involve lifelong processes, self-reflection, self-critiquing, openness to learn, it goes a little beyond just the openness to learn. I think the knowledge to appreciate different cultures, and I think that goes by intentionally developing cultural knowledge. Your background influences your perspective, so I think that it's a lot of developing those skills as you go. So that's, I think, looking at that with no judgment and respect, and maintaining a respectful relationship, as you're building that rapport with your patients. And so cultural beliefs play a significant role in shaping how individuals and families view substance abuse and the mental health treatment. Some cultures, substance use is primarily seen as a moral weakness, a lack of willpower, or even spiritual failure rather than a medical or psychological issue. As a result, adolescents struggle with substance use, may face shame, blame with their families. Rather than receiving help, they will just continue to use substances. In some communities, help seeking may not involve mental health or professionals. Instead, families might turn to spiritual leaders, faith-based interventions, or traditional healers for guidance. While these approaches may be meaningful and helpful with the cultural context, they might not address the full scope of actually what's going on, especially if it's co-occurring with mental health issues. As counselors, we must understand and respect these rather than dismiss them. I think we have to meet our patients where they're at, and that comes with navigating the waters that you are in. And I think that one of the best ways you can do that is build good rapport so that your families and your clients will engage with you. Cultural group adolescents belong to. It could be different races, ethnicities, African American, Hispanic, Native American, religion, Christianity, gender, LGBTQ teenagers face high risk of that stigma. Peer groups, economical standards. Adolescence is a critical period for families, and this is where your identity forms. Teens are influenced by their friends at this point. They're no longer looking to their parents to answer their questions. These include different situations in different groups. Culturally, this identity formation happens relatively the same, I would believe, with every culture. It just can mean different things in different cultures, right? So I think that it's important that we are supportive of that. Family and adolescents' attitudes towards substance use. Family beliefs shape how adolescents how they build that. Some families deny or ignore signs that their teen might be using. Others may normalize it, like it's kind of funny, it's kind of a cool thing when you're, smoking drugs and taking marijuana and stuff like that. Family beliefs is what it is. Attitudes towards substance abuse will shape the role that's played and how they respond to treatment. When teen family minimizes the use, oh, they're just teenagers, this is what teenagers do, and they downplay that, perhaps it's just a phase, or some kids do this. This can delay the intervention and then enable harmful behaviors continuing through teenage land into adulthood. On the other hand, when families acknowledge the problem, express concern without judgment and support, their teen is giving access to treatment. Researchers have said consistently, it shows open communication, family involvement, counseling, and emotional support increase motivation and the chance to reduce risk of relapse. And so moving between cultures, imagine being raised in one culture at home but expected to live by another at school. This tug of war can lead to feelings of isolation, pressure, and to fit in, making drugs or alcohol a tempting way to cope and to be the cool kid to fit in. Counselor strategies. Being culturally competent doesn't mean that a counselor must master every detail about every culture. That would be unrealistic and frankly impossible. Instead, cultural competency is recognizing that it begins with you being open, being leading, and prioritizing the client's lived experiences and assumption. Do not do any assumptions or generalizing. It requires us to approach each client with cultural humility, the mindset that we are guests in their world and we are experts in their own experiences, which asking thoughtful, respectful information such as client beliefs, family traditions, language preferences are not only appropriate, but they are essential to building trust and a rapport. True cultural competency also means flexible to adapt your clinical approach. This might mean adjusting your communication style, involving family members in treatment, planning spiritual religious values, or seeking community input. So my references are the American Counseling Association, Castro, F.G. Beltra, and Issues in Challenging and Designing Culturally Adapted Evidence-Based Interventions, Hernandez M., Cultural Competency and Adolescent Substance Abuse, Hook, J.N. Davis Owens, Cultural Humility, Sue, D.W. and Sue D., Counseling in Cultural Diverse Ways, and Olger Gelcher, that's a very tough one, Peer Social Influences and Risky Behavior Among Adolescents, Addictive Behaviors. Thank you.